Mr. Gates, the issue of handling, you said no country handled perfectly the COVID situation. But do you think this zero COVID policy by China backfired? And do you believe that, the entire COVID pandemic was actually something that went horribly wrong in a Chinese lab?
We're going to be discussing, did we do too little lockdown, too much lockdown? Now that we know that young people weren't very susceptible, maybe school should have continued, but what about the teachers? How do you deal with that? Academics really need to look at that data and help us understand that. China took a very different approach. They were able to suppress, even though the infection started there, they were able to suppress it. Most governments wouldn't be able to do that. Now it requires very strong measures to do that, and then later they decided to open up. They did benefit because by the time they opened up, they had some vaccination, and the strain at that point was a less damaging strain than we had earlier in the pandemic. But the origin, I don't bring anything new to that. I think it came across through animals, but there's lots of experts who will continue to debate that,
including those in the FBI.
Well, the U.S. government, I think of 6 departments, 3 say one thing, 3 say another. They say it with low confidence. So, I think lab safety is a good topic, but the most likely cause, and that we have to be ready for in the future, is that it comes across, like flu comes from birds and pigs, and so both require vigilance.
Mr. Bill Gates, you've been to the war room of the health minister back then in the COVID days. What was your experience, and what did you notice? And do you think it was sort of managing the scale at which the pandemic was happening effectively? What are your thoughts about that?
Well, India used digital systems to get their very high coverage rate. India has, for middle-income countries, about the highest coverage rate. So that's a real achievement. The thing I'm most excited about is now we're taking those digital systems and we're applying them to the ongoing health system, to make sure that drugs are not stocked out, to understand, are we getting the vaccines out to every child? And so this digital approach that the different states are innovating and sharing with each other under this ABDM mission, that's very exciting. So although the pandemic was a super negative thing, the way it's pushed digital into the health system to drive quality and visibility, that is very exciting.
And how does it rate to experiences of other countries?
Well, India did a lot of things well. The U.S., we've funded vaccine work, lots of money, and that helped out the world. India, with help from partners, was the big vaccine manufacturer. I think 4 companies, with Serum being by far the largest, did a really great job of ramping up. These vaccine companies are partners of our foundation because we've helped them create new vaccines, bring the price of the vaccines down. So we engage with them very early on, and we can write checks very, very quickly. And so it was great to see that all come together.